In today's episode, we tackle a subject that affects all women yet is often misunderstood.
Talk about menopause, but if you can define it.
27 years I worked as a private specialist gynecologist obstetrician.
Our guest speaker, Dr. Dave Glass, was born in rural Africa. He obtained his MBChB at UCT in 1975 and spent almost 13 years at Maluti Adventist Hospital in Lesotho, focusing on preventative healthcare. After completing FCOGSA, Fellowship of the College of Obstetricians and Gynecologists of South Africa in 1993, he practiced obstetrics and gynecology in Port Shepstone for 27 years.
Women's health issues, we know how to manage those from a medical point of view, from a pharmaceutical point of view, but we're not taught about how lifestyle can help to prevent a lot of the complications that happen, and how that we can improve the quality of life in Western disease as well. There was a Dr. Dennis Burkett in Uganda who started proposing the idea that it was the lack of fiber in Western diets that was causing it.
Looking at your medical education, was anything that prepared you to really meet the challenges that women go through, especially when it comes to certain things that can be prevented?
Well, unfortunately not. There are a lot of things that are not in our control, but there are a great deal that are in our control.
This topic of women's health, something that you wish women should know. There is certain lifestyle that can actually make the perimenopause come quicker.
Lifestyle medicine is actually the foundation of a healthy life.
Welcome to the 10 Times Healthier podcast with DrMuraHealth, where we simplify health concepts and empower you to take charge of your well-being.
Dave Glass, before we do start, I just want to thank you so much for this occasion to be able to meet me with this DrMuraHealth podcast. And I'm really hoping we're going to have a good discussion, especially with this topic about women's health. And I'm hoping that women that are listening, but also men, are going to gain some insight and something that can actually help both men and women navigate through this challenging period called menopause. But before we go into that, what about you tell us about yourself and what inspired you from going through medicine, and then specifically dealing with the health of women, and the latter parts, of course, the lifestyle medicine?
Well, I grew up in rural Africa. My parents were missionaries.
Right.
Started out life in the Transkei, and then we went to Zambia and then Tanzania and Kenya. And I was always interested in healthy living. My mother was very health conscious. And I decided that the best way to serve the community was through medicine. And so I managed to get into medical school. And then soon after I qualified, after I'd finished my internship and my community service, I was asked to go to Maluti Adventist Hospital in Lesotho.
Yes.
And shortly after I arrived there, the medical superintendent spoke to me one day and said that there is a great interest in the country amongst the mission hospitals of preventative healthcare. Would you be willing to start a comprehensive healthcare project at Maluti Hospital? Well, I knew nothing about preventative healthcare. I certainly hadn't been covered very much in my medical training.
Can imagine.
So I embarked on a course of learning as much as I could from other hospitals that had already started their program, as well as reading information, getting books. And in those days, we didn't have online materials like we do today. But there were some resources that were very helpful, and I became very interested in developing a program that would help us to deal with the causes of so many of the diseases that our patients had, rather than just trying to treat them. And so we started working with gastroenteritis, which was a major killer of babies. And we started teaching our patients, our mothers, how to make simple homemade rehydration fluids, and that dramatically reduced the number of babies that were admitted to hospital as well as who died from diarrhea. And then we also dealt with things like dysentery. We dealt with things like TB. Unfortunately, it was before the days of HIV.
Yeah.
But we were able to make a huge impact upon the causes of disease that occurred in the area at that time. And then I started learning, reading medical journals about the role of disease or lifestyle in causing Western disease as well. There was a Dr. Dennis Burkett in Uganda who started proposing the idea that it was the lack of fiber in Western diets that was causing it. And at around about the same time, there was also a researcher in South Africa, Dr. Alex Walker, who was looking at the differences in diseases between people who lived in rural areas in South Africa and those who moved to urban areas, and also between the different ethnic groups. And he did research over 50 years. He was one of the most prolific researchers in South Africa. He published close on 1,000 research articles by the time he died at the age of 93. So I learned a lot about the importance of lifestyle from these doctors. And then, of course, there was a lot of research that was starting overseas as well. So that got my interest in lifestyle medicine. And then I went and specialized in obstetrics and gynecology after 13 years. And the reason I chose obstetrics and gynecology is because it provides a broad spectrum of dealing with preventing illnesses in women.
Right.
And also, of course, in their babies.
Yeah.
But also it involved health education as well. And that was an area that I was very interested in. And then in the intervening years, for 27 years, I worked as a private specialist gynecologist obstetrician in Port Shepstone in KZN. And this gave me many opportunities to talk to my patients about healthy living. And then in 2020, I started doing a course in lifestyle medicine with the American College of Lifestyle Medicine. And at the end of that year, I did my specialty, my diploma in lifestyle medicine, 2021. And since then, I've been involved in lifestyle medicine, even after I've retired from obstetrics and gynecology.
Wow. That's quite very a good experience. So you moved to most of the African countries. You went to, of course, Lesotho, Tanzania, you mentioned.
Yes.
And if I may ask, that's a very, very long time ago. When did you go to medical school? Which year was that?
Well, I started in medical school in 1970.
I wasn't even thought of that time.
and I graduated in 1975.
Wow. Now, that's very, you somehow, I think you were very lucky talking about the education that medical students, actually the doctors that I have in preventative medicine and nutrition. I think you have a little bit more unfair advantage reading all the research that you mentioned, and also I think going through all these different countries, which I think prepared you through all your medical career. But looking at your medical education, was there anything that prepared you? Just now, talking about the women's health, was anything that prepared you to really meet the challenges that women go through, especially when it comes to certain things that can be prevented?
Well, unfortunately, not. Medical school, even today, there's not a lot that is taught about the prevention, about the causes, the lifestyle causes of many of the complications that people have these days. And even as far as menopausal women's health issues, there's a lot that deals with combating some of these complications. Like, for instance, menopausal symptoms, using hormone replacement therapy, and also dealing with other chronic diseases that happen, like obesity, hypertension, diabetes, all of those. We know how to manage those from a medical point of view, from a pharmaceutical point of view, but we're not taught about how how lifestyle can help to prevent a lot of the complications that happen, and how that we can improve the quality of life in women of all ages.
Yeah. Now, of course, the women go through different challenges or different changes. Men also do, but also fascinating. Actually, I was actually reading back, talking about how the gonads or the human reproductive system. I mean, in men, we're talking about the testes. In female, of course, talk about the ovaries. And by about 13 weeks for a girl, she had really, developed all the ovaries probably that she's gonna get.
Yeah.
And then at 20 weeks, the whole reproductive system is fully developed. So understand the ovaries become dormant, of course, until they reach puberty and then ovulation and all things. But it's fascinating that with time, then their eggs start getting, less and less.
Yes.
And that basically leads to, the issue of menopause. I just want to come to that quickly so that we can go to the issue of menopause. For men, it's nothing changes somewhat. The reproductive system, everything goes like that. But if you can just add a little bit more, what for women, just quickly before we go to menopause, what are other things that happens that are going to, of course, set up the whole menopause, perimenopause, and postmenopause?
Well, of course, just coming back to that point that you had, baby girls have a finite number of eggs in their ovaries. And even from the time of birth, the number of eggs starts to diminish.
Really?
Around about the time of puberty, there's something like 60,000, I think it is 100,000 eggs that are left from about 2 million at the time when 13 weeks when the ovaries first started to develop. And then each month there are a number of these that just die and disappear. So there's a finite number of eggs that are on the ovaries. And this varies from one woman to another.
Right.
For instance, there are some women who go through menopause at the age of 25.
Sure. That's
but the average age is around about 47 in southern Africa.
Okay.
And at that stage, then we'll talk a little bit more later about what causes menopause, but that is certainly one of the major factors. But other factors can also be diet. For instance, we know that in children that are exposed to a lot of animal products and saturated fats, the puberty tends to occur much earlier. So we're seeing young girls even as low as 7 years of age that are going through puberty.
Sure.
And these are girls who are very overweight and are eating a lot of junk foods, foods that have a lot of estrogenic compounds in them as well. So diet and lifestyle can certainly have an effect on when puberty occurs, and therefore it can also have an effect on reproductive conditions later on as well.
Yes. So basically, thank you for that. That actually what you just added, because it's my first time actually hearing that even at the age of 25, when you can actually study menopause. I can imagine that probably the menarche would have started way earlier as well. Probably
very often, yes.
So now, looking, we're trying to talk about menopause, but if you can define it, and then after defining what menopause is, then we can talk about what happens around the perimenopause, menopause, and postmenopause.
Okay, so menopause is defined as the cessation of menstrual cycles.
Right.
Okay, and it is caused by a lack of ovaries, or it is not ovaries, of eggs.
Eggs, yeah.
Ova. Okay.
Yes, ova, yeah.
So when the ova have been used up, now one must understand that when you are younger, the ova are much more sensitive, the eggs are much more sensitive, and they are more responsive. And as one gets older, the eggs that are left tend to be less responsive to the hormonal stimulation by follicle-stimulating hormone.
Yes.
This is a hormone that is produced by the pituitary gland. And so as one gets to the time of menopause, it is very possible for to have an egg that it responds to the hormones at that stage, but then there may be some months when there are no responsive eggs, and so therefore there are there's no menstruation, and menopausal symptoms like hot flashes may start at that stage. And then you get a responsive egg again, and then you have a normal cycle, and the hot flashes disappear. So this is what we call perimenopause.
I see.
It is the time of life when the ovaries are starting to give notice that they are reaching the end of their lifespan.
But it hasn't kicked in yet completely.
And also, sometimes at that stage, the increase in the amount of hormones that are produced by the pituitary gland causes an increase in the amount of testosterone, because women also produce testosterone, not as much as men do, but they also produce testosterone. So a lot of women start complaining that they're having increase in hair growth on their chin and around their lip, and this is a result of the increase in testosterone that is being produced because the ovaries are not responding so well to the estrogen stimulation, the follicle stimulating hormone. Yeah.
And then in menopause, then everything ceases.
So menopause is defined as the time when all of that is taking place. Postmenopause is defined as a year after cessation of menstruation. So after postmenopause, then we don't expect to have any more menstrual cycles at all.
Yes. So then, of course, we talk about what happened, what often called like a vasomotor symptoms, that hot flashes, night sweat. But what are other symptoms and signs that actually can happen that can be very debilitating?
So mood swings are very common. A woman can become very irritable, have difficulty sleeping, having difficulty often waking up at nighttime. Insomnia, which means that they are then very irritable the next day and they're tired because they haven't had enough sleep. They may have difficulty going to sleep or else waking up during the night. But then also there are other changes. For instance, the skin becomes less elastic, and so they can develop wrinkles and thinning of the skin, much more sensitive to sun and so on. And this also affects the skin or the lining of the vagina. It can cause thinning of the vagina, loss of elasticity. It can cause pain with intercourse. It can also affect the blood supply to the bladder and to the urethra. So the bladder becomes more irritable, they pass urine more frequently, and they have more problems with incontinence of urine. And also it can affect the muscles of the anal sphincters as well. So a bigger problem with incontinence of stools as well, which affects some women, especially if they've had difficult childbirth and have had damage to some of those muscles. So then also a person's emotional sense, feeling of depression, feeling of worthlessness, loss of body image, positive body image, and so they lose their sensuality, as it were. And this can affect their relationship with their partner as well.
That's quite a lot of things that happen. And I was when you meet when you're still seeing women, do you think they are aware, or do they know what's really going on, or do they attribute this to this period of life where they have to go through these problems, or you find they're not sure what's really happening?
Well, I think obviously it depends on the education,
of course, and
the environment in which women are living. I think these days there is a lot of information on the internet. People are much more open to talking about this. So I think there are a lot of women who understand what it's all about. But of course, being a private gynecologist, I'm dealing with people who are in perhaps a higher socioeconomic level, and their knowledge and understanding is maybe more than somebody who lives in rural areas, who hasn't been exposed to that. I think also in rural areas, women are expected to just get on and do what they need to do. And so perhaps they're not as aware of these things and don't take as much note of how that affects their lives.
Yeah. So you did talk about the follicular stimulating hormone, but what is the major issue? Of course, the issue is estrogen, right?
Yes.
It's the estrogen that's just going less and less.
Yeah.
If you can
So the main source of estrogen in the body, there's two sources. The one is from the cells that are around the growing egg. They are called the granulosa cells in the Graafian follicle. The Graafian follicle is a little combination of cells that helps to grow the little egg.
Right.
And those granulosa cells are the main source of estrogen in a woman's body. So once you run out of eggs, then you don't have any more granulosa cells, and therefore the ovaries are not producing as much estrogen. But also male hormones are converted in the liver into estrogens as well.
Yes.
And so there is always a certain amount of estrogen around. But it's interesting that there are other sources of estrogen.
Yeah.
And for instance, we know that there are bacteria that live in the intestines that manufacture estrogen.
Right.
And the diet and lifestyle has a profound effect on how much estrogen the intestines produce. Now, there can be an excessive amount of estrogen, and there can be too little estrogen. And so if, for instance, we're eating a diet that is low in fiber,
right,
and also high in animal products, particularly proteins and fats, then there tend to be much higher levels of estrogen, and that can cause too much estrogen, and increase the risk of certain complications like breast cancer and so on. Also, somebody who is very obese tends to produce more estrogen. And of course, obesity is often caused by lifestyle factors like the type of diet that you're eating, which often is a highly processed, which means there's very little dietary fiber, and also very rich in animal products and in fats, particularly saturated fats. So those are factors that can increase obesity, but they can then also increase complications of high estrogen.
Okay.
A diet that is high in a variety of fruits, vegetables, whole grains, nuts, seeds, legumes, means it's also a diet that is high in fiber.
Right.
And that tends to promote a wide variety of intestinal flora.
Yes.
And also a large number of intestinal flora. And that helps to keep the lining of the intestines intact. It helps to reduce chronic inflammation, which is another major factor that affects health. We'll touch on that just now.
Yeah.
But it also tends to reduce the amount of excessive estrogen in the body.
Right.
So that helps to maintain things. Interestingly, many years ago in the Far East, in Japan and China, where women very seldom had symptoms of menopause. In fact, they hardly even knew that they'd gone through menopause, except that they no longer saw their periods. But they had very little, they very seldom had hot flushes. And people have, and then as they have started to adopt the Western diet and lifestyle, they are starting to have more of the menopausal symptoms. And investigators tried to find out what it was about their lifestyle that prevented them from having these menopausal symptoms. And they decided that it was a number of factors. First of all, they were very active people. They ate a mostly whole food, plant-based diet. There was very little obesity. But also they ate a lot of soya.
Yes.
And we know that soya is rich in phytoestrogens.
Yeah.
And this can help to prevent the symptoms of menopause. And also helps the diet helps to increase the number of microorganisms, which also keeps everything healthy.
Yeah, in balance, yeah.
But as they have moved over to eating
like a West
fast foods and all of the things that we know are very common in the West, they're starting to have the same problems as the Western women are having as well.
Now, talking about the estrogen, though, of course, we know the ill effect of the estrogen that are found especially mainly in animal food, the dairy and animal food, and of course, talking about the issue of growth hormone. But now, if the problem is estrogen, that we're getting less and less, that of course that end up causing all these vasomotor problems. So, if you can eat food that is rich in estrogen, shouldn't that actually be helpful than rather causing more problems?
The problem is we're getting too much. Okay, so there's a certain amount that is healthy and there's a certain amount that is too much.
Right.
And also your phytoestrogens that you get from plants actually block certain of the estrogen receptors. There are a number of different types of estrogen receptors. So, for instance, in the breast, one of the medications that is given to women for breast cancer is a type of an estrogen, but it blocks the receptor on the breasts that tends to stimulate the growth of cancers. So these are much more likely in women who are taking phytoestrogens. They are less likely to have breast cancer, but they will have enough estrogen that is going to prevent the hot flushes.
I see.
And vasomotor symptoms, and also the dryness of the vagina and so on as well.
Okay, so then what do we have then? We have, beside the onset of perimenopause or menopause, there are certain things, there is certain lifestyle that can actually make the perimenopause come quicker. You just mentioned sedentary lifestyle or obesity, and this lifestyle, based on mainly animal food. What about the menarche, the start of the menstruation period? Does that also have something to do with how quickly the menopause is gonna kick in?
Unfortunately, not necessarily.
All right.
Sometimes taking all of these extra estrogenic type things can prolong, the
onset.
Yes, the onset, so that increases the amount of estrogen in the body. It can result in a number of different things. It can cause heavy periods. It can cause adenomyosis. This is where the lining of the uterus starts to grow in the wall of the uterus. It can cause endometriosis, which causes excessive growth of the lining of the uterus outside of the uterus. So these are all things that can happen from the excessive amount of estrogen that we're getting.
And of course, when it comes this period, it was actually interesting. I read something talking about. It is a study actually that was done in Tshwane district here in South Africa, where you're talking about how the women view this period of menopause. There is one incident where in Zulu culture, for example, when women reach menopause, it's kind of, they see that as a good thing. They are a little bit more free. They can go to when they have a menses, probably they can go to the crowd where the cattle are, and many other activities that they are not otherwise allowed to do. It's kind of a freeing type of things. On the other side, the other group of people, of course, who see this as being entrapped. It's more like they have disease. It's like their womb is disease. There's kind of a mixed approach how people see this. But I wonder, when it comes to men, where is the man in the whole picture? Do they understand? Of course, with this menopause kicking in, sexual intimacy is going to be affected. And many other things. I mean, you talk about mood swings, there are depression, and the other things that are coming in. Do the partners, do the men understand what's happening?
It depends. I think there is a big problem with patriarchy in Southern Africa, where men don't really care about what their wives feel, and just expect their women to provide for their needs, both physical as well as sexual needs and so on, without taking into consideration what a woman is going through. So, but I think this has to do with male understanding, male attitude towards women in general.
Right.
But there's no doubt that a woman can lose her sexual desire when she reaches that stage of life. And this can have an effect on the relationship between the husband and the wife. And it's important, I think, for men to understand this. And to be willing to negotiate, as we like to say. Sometimes the man doesn't have to go through the whole process of foreplay and arousing his wife if she's not interested, but the wife might be willing for him to just satisfy his desire for sexual fulfillment. So these are things that can happen where husband and wife can work together and still get pleasure from the relationship.
Yeah, definitely. And so in the menopause, of course, the whole there is all these oxidative kind of stress that happen, and the pro-inflammatory pictures. Yes. I was actually reading other studies showing how if women that are eating, like coming back to food, women that are eating pro-inflammatory food, such animal product, dairy, animal food, they have more vasomotor symptoms.
Yes.
This is those who actually tend to eat anti-inflammatory kind of food. So is it because and there's a shift, because you find the women who has been other fine, they've been eating unhealthily, so to speak. They don't reach their menopause, the age of, is it now, which age, by the way, now we have like 46?
Average is 47.
47.
Yes, 47 to 49.
Yeah. So they've been eating the same way. They don't reach 47, started to change their diet, started eating unhealthy. They didn't change what they ate. But suddenly something happened. So, of course, somehow with the studies, some of the study mentioned, with these women, if they started eating anti-inflammatory type of food, their symptoms get better. But why this particular period? It does also estrogen act as, anti-inflammatory somehow, and then suddenly when it started weighing off, then everything's open up.
Well, let's go back again, because this concept of chronic inflammation is very important.
Right.
In fact, there are many scientists who say that the basis of all chronic diseases is chronic systemic inflammation. Now, how does our diet and our lifestyle impact that? Well, we come back again to the concept of dietary fiber,
right,
and the health of our microorganism, our microflora. In our bodies, we have something like between 30 and 100 trillion, not billion, but trillion microorganisms. We have something like between 10 and 20 trillion cells in our body, like skin cells and blood cells and bone cells and muscle cells and all the rest. So we have something between 5 and 10 times more microorganisms than we have actual cells in our body. And these microorganisms have a very important role to play in our health. For instance, in our intestines, there are bacteria that increase the substances called short-chain fatty acids.
Yeah.
And these help to maintain the integrity of the lining of the intestines. They also increase the production of mucus by the cells that line the intestines. And this provides a barrier so that there's no damage to the lining of the intestines. But when there is a diet that is low in fiber and therefore much fewer bacteria, the lining of the intestines becomes disrupted, and you get these little cracks, as it were, through which bacteria as well as larger proteins can then penetrate. And these then stimulate the immune system they also can get into the blood system and then cause an increase in inflammation, chronic systemic inflammation. So things like diabetes and high blood pressure and arthritis and other autoimmune diseases and even atherosclerosis and even dementia.
Even cardiovascular disease.
Yes, cardiovascular diseases all are increased when our diet is low in fiber and therefore has a lower amount of helpful and healthy microorganisms.
Yeah.
So that affects also even the endocrine system as well, and this can cause greater complications from the diseases of menopause too.
Right. So I will talk about menarche, maybe not much contributing. So, but when it comes to the age of, birth, giving birth, I think I was reading a study showing how, albeit it might have been in USA, that the age of first giving birth was around 21. Now it is moving to 26.9. Does that affect? Does that have any relation to menopause whatsoever when it comes to the giving birth at a later age or early age, and also on the same breath, breastfeeding, not breastfeeding?
Okay, so the problem is that our eggs, a woman's eggs that she produces, become less responsive, as I mentioned before, as she gets older.
Right.
So her ability to be able to achieve a healthy pregnancy does tend to diminish. And it doesn't just stop all of a sudden, except, of course, at menopause, but it becomes less as a woman gets older. So here at 35 years of age, the incidence is still pretty good of the chance of her achieving a pregnancy. But as she gets older, up to 40 years of age, the chance of becoming pregnant and having a healthy pregnancy becomes much less. But also the chance of having eggs that have the DNA has become damaged also increases. So her chance of having a child that has genetic abnormalities increases, like Down syndrome, for instance. So we tend to encourage women to have their children at a younger age rather than waiting until their late 30s and early 40s because of not having as much chance to achieve a pregnancy, but also having greater complications of all different types of complications, both genetic as well as medical complications, blood pressure and heart problems, kidney problems, and so on during the pregnancy.
All right. So we're talking about, of course, the different things, how this menopause, it doesn't affect women the same way. Of course, you did mention how even the eggs, they are not necessarily the same number that we're starting with. But with time, there's, of course, the thing that how our lifestyle can also affect, not necessarily probably whether we go through it or not, but are we going to do it smoothly or not? You did mention about the experience in Japan, how people women didn't even know what that is. They didn't have much problem. Do we find that of course, we know for sure the menarche is starting way early in girls because of the lifestyle, but did the age of perimenopause, menopause somehow is coming younger than, or still more or less the same in Southern Africa?
I think it tends to be in people who are westernized. The menopause tends to be a little bit later,
right?
Which of course then increases the risk of estrogenic complications, such like for instance breast cancer, for instance, is very common. Another thing that I want to just discuss is we talked about differences between women.
Right.
Not everybody is the same. And it's important to know that there are approximately 20% of women who have severe menopausal symptoms, like hot flushes, to the point where it actually interferes with their self-confidence, it interferes with their sleep, and that can be a problem for their general mental function as well. So we found that approximately 20% of women will get hot flushes. Well, let me just go back. Most women, if they do get hot flushes, it lasts for around about 1 to 2 years, and then it tends to settle down after that. But there are some women who will get hot flushes for the rest of their lives and can be severely affected by it unless they go on to some kind of hormone replacement. So there is a place for hormone replacement therapy.
Right.
In a woman who has still has her uterus, it's important that she goes on to a combination of estrogen and progesterone,
okay.
because the progesterone helps to protect the lining of the endometrium from overgrowth and increasing the risk of cancer of the lining of the uterus. But for women who've had a hysterectomy, they can go on to plain estrogen. Now, there was a big study that was done some years back called the Women's Health Initiative.
Yes.
Now, the Women's Health Initiative looked at 2 groups of women in menopause. They took, I think it was something like 10,000 women who'd had a hysterectomy, and they put them onto just pure estrogen on its own. And then they took another group of women who still had a uterus, and I think there were 17,000 of those, and they were put onto a combination of both estrogen and progesterone for the protective effect of progesterone. And then they followed them over the next number of years,
Right.
looking at heart disease, osteoporosis, and so on. And they found that those who were on the combination of estrogen and progesterone had a higher incidence of breast cancer. So it was a combination of estrogen and progesterone that increased the risk of breast cancer. Those who had had a hysterectomy and therefore were only on estrogen had a lower incidence, much lower incidence of breast cancer. So there are some advantages in some women to taking estrogens. So we are not trying to say that you must not take any estrogens, because they can be beneficial in certain circumstances.
Right.
For instance, also one of the other complications, which is dryness of the vagina,
Right.
that can cause a lot of problems, for women, and particularly for their sexual function. And we find that if we give them a very low dose, every week estrogen cream, or a pessary in the vagina, this can help to improve both bladder function as well as vaginal function. So there are some benefits in using some estrogens. But on the whole, our lifestyle, how we look after our bodies and so on is helpful. By the way, we talked about how that soya is particularly useful for producing phytoestrogens.
Yeah.
But in fact, most beans, most legumes produce phytoestrogens, maybe not as much as what soya does.
Okay, wow.
And the soya, of course, there are many ways of taking that. Can be with tofu, which is a concentrate, it's almost like soya cheese, is probably the richest source, but also from soya milk and eating soybeans as well, and soya products can also produce phytoestrogens.
Yeah. So, talking about of course, coming on the treatment, of course, I understand the studies that you mentioned. I think there is a time where, hormone replacement therapy was given to everyone.
Yes,
and then that's where they started coming in. And I think then there was a hold almost to cut off all the HRT, to be given. And of course, then you find that, like what you just mentioned, it's not just one size fits all. Those who have had a hysterectomy, then it can be easy, but you can also adjust depending on. I think the major issue, though, of course, besides breast cancer, of course, we find that also women do have increase the risk of cardiovascular disease as they go through this. Did hormonal replacement, thrombosis as well. So, and there is a bit association with weight gain as well. So what you're saying is there is it's more like a specific approach, person to person approach.
Absolutely.
And how they can actually improve their health. I know we do have what we call the South African Menopause Society.
Yes.
I think they issued a new, not necessarily a new approach, but the revised approach to hormonal therapy. And I think, again, comes in to say that depends on, it had to be individualized.
Yeah.
Because the studies also somehow they come conflicting and stuff. But based on what you've seen in your practice, of course, the women who use hormonal therapy, they did get improvement in their symptoms.
Yes.
Yeah.
Unfortunately, it's taking time for the medical fraternity to understand the role of lifestyle interventions as well. So they tend to downplay, diet and natural, so-called natural hormonal things. And the reason is that there's not a lot of research that's been done. And this is where it needs to be done so that we can find how best to manage this.
Yes.
There is a researcher in the States by the name of Dr. Neil Barnard, who has done a lot of research on many different aspects, on cholesterol, heart disease, diabetes, and so on. But he's also been doing some research on hormone replacement and hormonal problems.
Yes.
And he's written a book called
Body in Balance.
Yes, The Body in Balance, which is available. One can get hold of it in South Africa as well from various online sources. So that is quite helpful. And it certainly is looking at other women's conditions like endometriosis and adenomyosis and heavy periods and so on. So even things like acne can be affected by our lifestyle too. So there's a lot that can improve with women's health if we are getting enough exercise and getting enough sleep at night time and also eating correctly.
Okay, so basically what you're saying is, of course, we still have a room for treatment. I mean, and also I think, for example, also depends on the symptoms. If you have a woman who's the main problem probably have a drying of vagina and other things, rather than giving systemic, treatment, you can even give just a local the lubricant that can actually assist. But having said that, also you're saying that if people can actually change their lifestyle and trying to eat, anti-inflammatory type of, diet and of lifestyle, such as lifestyle exercising can be anti-inflammatory.
Yes.
Eating food that are more high in, less in animal saturated fats and more fruit, vegetables and legumes, they can actually, their symptoms can actually get better.
Absolutely.
Definitely, yeah. And so now when we come to this lifestyle change, I don't know, the women that you interacted with, is it difficult? How do they come along with a lifestyle change? Because often, like you said, while we don't have much research, we have ample evidence how this can work. But when it comes to practically do those things, do you find women are equipped or to deal with?
Well, I think this concept, lifestyle medicine in terms of general health, chronic non-communicable diseases, is very well established these days. But I don't think there's enough research that's been done on women's health and the role of lifestyle medicine in dealing with those. I retired about 2 years ago, and it was only since I retired, actually, that I discovered the role of diet and exercise in dealing with women's issues. So although I spoke often to our patients about the role of dealing with things like diabetes and hypertension, high blood pressure, and lifestyle factors, I didn't often speak to my women who were going through menopause because I didn't know about it at that stage. So it's something that is fairly recent and new. And I'm sure there needs to be a lot more research done on this.
Definitely. Now, when I was actually, it's more curious looking at this period of menopause. What does men go through that it can be similar to menopause?
Well, I think part of the problems of menopause is what takes place in a woman's social life at that stage in life. So, for instance, very often at that stage, her children have left home. there's this condition called empty nest syndrome, where she wonders what is her purpose in life, because she's not having to rush around looking after the children anymore. And this comes on to another aspect which you had talked about, and the role. Why is it that in animals, menopause is associated with mortality? In other words, most animals, when they reach the end of their reproductive career, they die. Except for two animals, and that is whales, and there's two kinds. There's the killer whale and I think it's the right whale is another type of,
I didn't know.
Or pilot whale. Both of these whales have menopause. In other words, they stop becoming reproductive, but they still continue living for some time after that. And I think this is a divine creative genius for women to live still long after they are able to produce children, because women still have a very important role in giving guidance to their daughters and also to their sons, although the daughters-in-law don't usually like advice from their mothers-in-law. But, also to provide for the grandchildren. I mean, there's nothing. My wife is a grandmother 4 times over, and she says her relationship between herself and her grandchildren is very different, and also, if not as intense, more intense than between herself and her children. And grandchildren need to have that guidance and that love and that support from grandparents. So this is why I think in humans, because we have eternity to think about, and because we are responsible people in this world, it's so important to have mature, wise grandmothers around to provide that guidance. Yeah.
No, definitely. So it's amazing that you mentioned actually that a few animals actually that go through that, and I think there is a plan. That's where often I defer to say that actually we coming from animals. Like some people, they're trying to see this issue of menopause, and they will think that we were not meant to live that long. Maybe now we overlive where we're supposed to live. That's why we're having all these problems. It's a penalty of living longer.
Yes.
But when you look at the biblical records, I mean, you have Abraham living to 900 something, and you have even after sin, everything continue going down, but you still having people living way longer. So I think I agree, Conquer, with you that there's a purpose having that because that wisdom that of our parents for their grandkids, but also for their children as well. And not only that, in society, economy continue to run somehow with that wisdom that invested in older people. So I think there is a specific purpose. Yeah.
You talked a bit earlier about the role of men. Is there a change that takes place in men? I think both men and women come to a point where they begin to wonder what is their purpose in living. Men, it usually happens maybe a bit later on when they stop work, when they retire. But I think for women it happens a bit earlier. And this can be quite a challenging time. And it's important for women, even if you are not as busy with your children and your grandchildren, to find something that gives you a purpose to wake up in the morning. So whether it involves working in the community, doing something that is helping society, whether it is being active in the church, whether it is using your gifts and your talents in positive ways, can improve your general health as well as improve your sense of well-being as well. And that can also help to deal with some of these psychological and mental issues. Depression, one of the questions that you had asked earlier is menopause associated with depression?
Yes
and no. menopause does not cause depression, but if one has depression, and around about 70% of people in the world today suffer from some depression at some stage. If you have depression, then the changes that take place in menopause can aggravate the depression.
True.
And make it a bit more difficult to manage. But I think, as we mentioned, one of the most important factors in dealing with depression is lifestyle. By exercising, we know there's a lot of scientific studies that show that exercise can help to reduce depression and anxiety symptoms. So being active that way, and then having a purpose, can also help. Getting enough sleep at night time, eating the right foods. We know that eating lots of fruits and vegetables. In fact, psychiatrists are beginning to acknowledge the role of a healthy diet in managing psychological or psychiatric illnesses. Obviously, if somebody is severely depressed and so on, then they have to be treated as well. But lifestyle is a very important part of that management. And then, of course, a lot of men are starting to put on weight. And they are also having the diseases that are associated with age, and that can affect their psychological well-being as well. And their sexual desire might be waning. They're having problems with impotence and erection problems because of cardiovascular diseases as well. So these can all affect the relationship between the husband and the wife. Sometimes the husband tries to blame the wife for his problems, but it's actually his own problems that he's suffering, and he's trying to find a scapegoat for that. Sometimes also men find that their wives are not so sexually desirous anymore, and then his eyes start to wander to other places, younger women, and that can cause a problem with marriage as well.
And that's the question actually I was thinking of as is it finding a lot of divorce within that period? Is it because that's the time, just unrelated to what is going on? Is it that time where they had enough, either men or women, they just want to separate? Or these symptoms and the whole period of menopause do tilt people over to say, what, enough is enough, and then you have a lot of divorce within this period of time.
There's no doubt, looking at the statistics, that there is an increase in divorce at that stage. And why is this? Well, a number of reasons. One of them is the fact that the relationship may have been unhappy for a long time. But the wife or the husband stay together because of the need to provide stability for their children. And now that the children are no longer dependent upon them, they feel free to be able to get out of that relationship. The other thing is, of course, that men may become more irritable because they're having health issues, they are not satisfied in their work, or that they are overworked, that they are expending their time and their energies in their work, and they don't have time to nurture the relationship, and so the relationship then sours. Or for a woman, it might be that she has a loss of self-worth, her body image is suffering under the results of aging, and she no longer becomes sexually active and attractive, and that can affect the relationship as well. So there are a number of different factors. It's not just one factor.
And but the good thing is there is always hope, especially just changing one's lifestyle. It's not only for that menopause, it's also the changing the whole life, because this is the time, because of how long one would have been probably practicing unhealthy lifestyle. This is the time also the one started getting diagnosed with certain cancers, hypertension, diabetes. But if one can actually change preemptively, even before one reaches this period, if you can live healthier, one is likely to go through the period, this stage easy and ongoing as well. One continue to get better and healthier. But does it get better after menopause? Postmenopause?
Yes, it can do. I mean, a lot of women find that, as you mentioned earlier, the study that you heard about in South Africa, Some women feel a tremendous sense of freedom, that they don't have to worry about menstruation anymore. They don't have to worry about whether they're going to get pregnant,
Yes,
and
or
they
not.
don't have to worry about using contraceptives anymore. So there can be a great amount of freedom, and then also the fact that they're not looking after their children can give them freedom to be able to pursue other activities that they enjoy doing, whether it's physical activities or whether it's hobbies and stuff.
Yeah.
Interacting with other people and doing useful things can also give them freedom. One other factor about the changes in lifestyle, as we improve our health, it helps us to sleep better, which then helps with the problems of fatigue and irritability. Also makes us feel better about ourselves and about our lives. Our skin improves. It can help to reduce all the medications that we're taking, which often have a lot of side effects. But for men, it's interesting, and perhaps also for women, that it can increase sexual desire and also sexual performance
as well.
We know that as people adopt a healthier lifestyle, men, that they have improvement in their erection. And in fact, there's some very interesting and quite amusing studies that have been done recently, even on young men.
Right.
If they are eating a diet that is very rich in animal products, they don't have as many erections at night time.
Oh, yes.
Whereas those who are eating a whole food plant-based diet have a much greater number and also length of erections. So it's interesting that there's quite rapid improvements just in the space of a few weeks that can make a difference. And it can also affect women as well.
Definitely. And when we come to, of course, we did talk about a little bit about men. Of course, often as the time changes, people are getting more, educated. Even men are getting to really understand a little bit what their wives, their women are going through.
Yeah.
But as a man, what can we really do to be able to ease this period?
I think most important is to give a lot of affirmation and reassurance to your partner. To make, let them know that you care about them, that they're beautiful, that they are attractive, that they are still sexually attractive as well, even though they may not feel it themselves. But spending time talking to them, interacting with them, doing things together is so important in the relationship.
Definitely.
As one pastor that I remember was reading recently a book that he wrote on marriage. He says the most important thing is communication. And the 95% of all marriage issues are a breakdown in communication. So it's important to maintain that communication.
Of course, we talk about exercise and many other things, but I think from having a purpose and also having certain belief in a certain, I believe in God, or to know that it is someone who's actually interested in your health beside your partner, of course. That can also propel you feeling, knowing that you are not alone and also getting better as well.
The importance of realizing that you are not living in isolation in this world. That there is a God who has a personal interest in you as an individual, and that each day can be a wonderful opportunity to work in partnership with Him. Makes a huge impact upon our purpose in life and our ability to be able to face the challenges of life. When we realize that we have a companion who is going through, sometimes we think that God is not involved in us because bad things happen. But the important realization is that God is with us as we go through those. He doesn't necessarily prevent bad things happening, but He goes through those difficult things with us.
With us. And that's a really comforting thought.
Yeah.
We covered quite a lot. I'm sure there is the audience is the viewers are gonna have more questions. But is anything else that you would like to, especially on this aspect, this topic of women's health, something that you wish women should know, or rather that can help them in their journey?
Well, I think the most important I'd like to summarize is that there are a lot of things that are not in our control, but there are a great deal that are in our control. So if we choose to and this is a journey. Sometimes we think that if we don't go all out, that we haven't achieved very much and we give up. But every change that we take in that journey along the way to an improved diet, exercise, and so on, has benefits. And as we adopt those changes, we will feel the benefits, and it will inspire us to adopt more benefits.
Definitely.
So don't feel like unless you can do everything, change everything, that you have failed. No, but work on what you can do, and as you do that, you will find that it will increase your motivation to do things that are more difficult to change.
Definitely. Now, looking back, when we started, I was talking about how you did have, a good advantage of learning from the, people who really have learned much about preventative medicine, albeit the normal convention training that you also received didn't necessarily focus on that. Now, looking back, of course, you just retired. But if you would have to practice again, would you treat patients differently?
Oh yes, very differently. No, I would incorporate. It's lifestyle medicine is actually the foundation of a healthy life.
True.
So it's not to say that I wouldn't also still give medicines, do surgery, all those kind of things, but I would certainly incorporate. And help my patients to understand the role of our lifestyle choices much more. And I might well find that I wouldn't have to do as much surgery or use as many medications,
True.
Which would be beneficial to patients' health.
That's good. That's good ending point. Thank you, Dave, for this occasion. It was very, very, very nice. And I'm hoping the lifestyle medicine becomes really the new norm at Dr. Mura. We're trying to make, lifestyle, change so that people can learn. I mean, people probably they won't necessarily change. All of them, they won't change. But at least to know that there is something they can do. To know that there is another side, if they will change, how they can actually be. And that's our purpose. And thank you for today.
Thank you very much for the time we could have spent together talking.